Welcome to In-Depth TV. My name is Dr. Joseph Santoso. I'm a GYN oncologist. We discuss topic relevant for your health. And today I'm very excited to welcome Dr. Jankov. And Dr. Jankov has been known to win many awards, including the Top Doctors by Memphis Magazine. Dr. Jankov, welcome.
Well, thank you, Joe. I'm delighted to be here.
Thank you. Tell us about you a little bit more. Where do you practice and where you come from? You have interesting background.
Well, I've been practicing in Memphis for the last 15 years. I'm a medical oncologist and hematologist. I subspecialize and my focus is on gastrointestinal malignancies, breast cancer, and brain and spine tumors.
Wonderful. Malignancy means cancer.
Correct.
You mentioned about the colon cancer. How common is colon cancer?
Colon cancer is very common, and I would like to kind of entertain you with little geographical kind of distribution. I call this a zip code factor. So if you tell me where you live and what's your zip code, I could kind of guess what would be a risk factor for colon cancer on a global scale. So there are 4 areas that have a very high incidence of colon cancer compared to the rest of the world. So North America, USA and Canada, New Zealand and Australia, and West Germany. And for example, Africa mostly has very low risk for colon cancer. So I come from Serbia, and basically my risk for colon cancer is now higher than my friends over there, and my kids' risk factor who were born here is higher than mine.
Why is that?
It's the lifestyle. It's the whole package, which includes not only a diet, which is certainly the case, but also the level of activity. The genes are pretty much the same.
Correct.
It's what we do every day, or not.
Let's go more in depth in terms of diet. You know, we have all kind of diet around, people trying to lose weight. How does food correlate or contribute to my colon cancer risk?
It contributes to several reasons, but it does contribute to a great deal. And first of all, we don't even notice this because it happened gradually. But our food is incredibly energy dense. It is, and it's not really rich in variety. In a fistful, you open your palm of your hand, you can have 1,000 calories of energy right there. So this is really not good because there's no fiber. The energy is incredibly energy dense food, which is not favorable for colon health. Then in addition to that, diabetes is a risk factor for colon cancer. And there's millions of Americans who are suffering from diabetes. 90% of them are obese. Mm-hmm. So in addition, there's a latest estimate that 40% of American population is unfortunately now in obese category. And in addition to all of this, we have what I would call Netflix factor, which is in the past, we used to kind of be sedentary during our work or educational days, and then we would, go for a leisure time and move around, be outside. Nowadays, our younger generations are mostly pinned down to a couch, surfing the social media or Netflix. And while I certainly enjoy a good show, I would tell you that this is associated with a tremendous amount of inactivity. And mostly now we do cognitive work, so that's one long stretch of inactivity. When we are inactive, our electrical muscle activity goes practically to zero. So those are some of the factors that contribute to colon cancer in majority of people. Age, lifestyle, diet. There are some other risks that contribute to a colon cancer, such as inherited syndromes, such as Lynch syndrome, inflammatory bowel disease, previous treatments for cancer previously that patients had, such as radiation to the abdomen. But those are not present in majority of people.
Our audience may be concerned now about colon cancer. What can they do to reduce their risk? Is there any screening for colon cancer?
Yes, you can you can prevent cancer two ways. You can have something called primary prevention, which is you do everything to the best of your ability to live healthy. And then there's a secondary prevention. Secondary prevention is that you can have colonoscopy or other screening methods that could detect cancer before you have symptoms. So screening is a term of applying a certain test in the people who have no symptoms of cancer. And that is the best way to discover the cancer. So if you can discover the colon polyp that is pre-malignant, precancerous, that is the best way to remove it and actually eliminate the possibility of developing colon cancer down the road. In addition, next best thing would be to detect cancerous polyp or early stage 1 colon cancer, which is almost always curable. So those would be secondary preventions. And there was quite a bit of excitement in the media with the latest guidelines by American Cancer Society that actually changed the guidelines. And instead of you being at average risk at age 50 and needing colonoscopy or other screening methods, now it's recommended to start at age 45.
Wow. So it's earlier.
It is 5 years earlier because while the colon cancer incidence has been declining in general, it happened for older generations. But for millennials and some of the Generation X people, actually the risk for colon cancer incidence has been increasing.
Dr. Jankov, after our audience gets screened at age 45, how often do they need to keep on repeating the screening, the colonoscopy?
Yes, excellent question. I think that will depend on what your gastroenterologist doctor who does the screening finds there. So you can have GWAG-based stool testing for cold blood or something what we call FIT, fecal immunohistochemical testing, or you can do one of the newest methods, which is called stool DNA, and you can repeat them either annually or every 3 years if the results are negative. However, if the results are positive, then you should definitely have a colonoscopy and be evaluated by a specialist. If, however, you have colon polyps, they're precancerous, your gastroenterologist will say, we should take another look in 3 to 5 years. And this is something, or they may set up the frequency.
Very, very good. Is there any symptoms that our audience needs to watch for colon cancer?
Yes, there are symptoms. If you have a bowel habit changes, the blood is the most alarming symptom. If you notice either very dark color of your bowel movements or a bright red, definitely I want you to go to the doctor. But you could also develop thinning of the caliber of your bowel movement of your stool, or having a problem as well, trying to have a bowel movement, having a lot of cramps, abdominal pain, bloatiness, weight loss. You also could develop anemia, especially if you're losing blood in an occult fashion that you don't even know that you're bleeding. And anemia could be, an iron deficiency could be a first sign.
Very good. It's interesting that you mentioned you could predict somebody risk factor for colon cancer by looking at their zip code. Is there any differences in race, gender, in terms of developing colon cancer?
I think what we know so far, we know that Japanese people have a high risk for stomach cancer, but when they immigrated to North America, they have actually shifted that to a high risk for colon cancer. The same thing for people originating from Africa, immigrating from Africa. So I would still think that it's the lifestyle that actually influences our risk for colon cancer.
Very good. So say some of our patients have developed colon cancer. Is it a hopeless case?
No, as a matter of fact, the reason we are talking about this is that far from hopeless. It gets better and better every time. But you and I are talking about this because we want to have it early. We want to find it early when we have a more than 90% chance of cure. We want to, millions of people are unscreened. So millions of people who should be screened are not being screened. And up to 30% of patients who get diagnosed with colon cancer have never been screened. And those are the ones who usually get diagnosed with the later stages. So sure, there is an incurable form of colon cancer, which is stage 4, and unfortunately that happens. But colon cancer could totally be prevented and or found at a very early stage when cure is almost guaranteed.
What do you think are the factors that make some people have less frequency of screening?
It's a multifactorial. I know it sounds like a cliche, but sometimes it's an access to healthcare, insurance reasons, preference, inconvenience. That has gotten more convenient now with a test called Cologuard stool DNA. I think the raising awareness of the necessary screening.
I'm sorry, what did you say again?
Stool DNA is what I mentioned previously. It is the patients can avoid having repeat colonoscopies by newer techniques of, I want to describe this. So basically, polyps and cancer cells shed their DNA into the bowel movement every day. And this can be detected, and you can detect whether this DNA is abnormal or not in the stool. So it's akin of looking at a needle in the haystack. You don't need to know where that needle is in the haystack. You just need to know whether it's abnormal or not. And if it tests abnormal, then you definitely can recommend to the patient, and patient would then be wise to have colonoscopy and to have direct visualization of the colon.
But it doesn't replace colonoscopy, though.
It does not, but if you keep getting negative results, you can avoid it. And if your test is negative, today, your next scheduled testing will be 3 years from now. So some patients strongly prefer that to be screened that way.
In the event that, unfortunately, one of our audience developed colon cancer, how do you treat colon cancer these days?
The treatment is surgery. So it's resection of the part of the colon that is affected, and that in an early stage that should take care of the problem. You'd be basically cured. However, if your cancer is more advanced and involves the deeper part of the bowel wall or affects the lymph nodes, then in that case, after the surgery, you may need also a chemotherapy for a period of time.
Some of our patients says, chemotherapy, they're poison. Could you share with us what's the newest thing on chemotherapy and what are the side effects? What is chemotherapy?
I sure understand some of the patients who feel that way. You know, sometimes I joke that I give toxic chemicals for a living. That is true, but chemotherapy actually helps you about one part that is very difficult when it comes to cancer. So cancer has an invisible part. It has those cells that may circulate throughout the body, and even though surgeon removed everything and they will tell you, I got it all out, there's still a possibility that some cells have traveled somewhere else. And you really need chemotherapy. You cannot see them now.
Very good.
But they can mushroom later on, and so you need chemotherapy to basically eliminate them wherever they may be and to improve the chances of cure at that time.
And that's given intravenous through your blood vessel?
Yes.
Or do you take by pill?
Great question. There are some chemotherapies, yes, mostly given IV, intravenously, but there are some chemotherapies that are as good given in a oral form by tablet.
How about radiation? Any role in colon cancer?
Radiation has a role in rectal cancer, which is the last part of the rectum is the last part of the colon, large bowel, and those patients will require radiation as part of their treatment.
This has been a great session, Dr. Jankov. I learned so much, and thank you for sharing your vast knowledge with our audience.
My pleasure, Joe. Thank you for having me.
Thank you. Thank you for listening, and this is Dr. Joseph Santoso speaking with Dr. Jankov for In-Depth TV. See you next time.